Dr. Macero.
Thank you, Councilmember Quinlivan. Good morning, everyone. This effort actually was a 2-year project with our collaboration with Xavier University. Dr. Hooker led that team. The total initiative was more or less came out of a conversation that Dr. Jones, who you'll meet momentarily, that occurred with Marilyn Evans and Communities United for Action. So many of us, as probably a month doesn't go by, whoa! Sorry. Well, fortunately, I don't have any bodyguards or agents around, or I'd be on the floor. Yeah.
What's your name?
Noble Macero. Okay.
I'm looking for my purse. I think
Okay. So, as I was saying, most of us definitely, just about a month doesn't go by where there's some kind of a report in the papers that says that life expectancy or some report about how the breast cancer rates have diminished. And so with that said, it's a colossal effort that was led by Dr. Jones and her team. And so let me certainly now begin the real meat of the session this morning and introduce Dr. Camille Jones, who will introduce the rest of her team and give you details about the report. Dr. Jones.
Thank you, and thank you all for coming.
So as Dan just mentioned, these are going to be your overall crude rate, and what we're looking here is Cincinnati versus Ohio. Your Cincinnati bar is going to be your red bar, Ohio is your blue bar.
And these are the top 10 causes of death: heart disease, cancer, stroke, chronic lower respiratory disease, chronic obstructive pulmonary disease, asthma, diabetes, unintentional injury, Alzheimer's disease, kidney disease, influenza and pneumonia, and assault, homicide. And these are the Cincinnati rates for these particular diseases. And for some of these, like stroke, like diabetes, like assault, we're a great deal higher than other large metro areas in Ohio. And so again, this is something that tells us that there are things that we need to be doing and looking at, what can we do to help improve health in Cincinnati.
I have a question and a comment, may I?
Please.
My name is Rachel Lewis. I'm 84 and a half, and I'm a member of the Vegan Earth Society, and I don't eat animals or dairy. And I believe that until we start focusing on what's causing this, we'll continue to have it. We asked the mayor to sign, what's the name of the organization that asked the mayor to sign proclamation that we would just have one day a week vegetarian, no meat. We know that eating animals and dairy is what causes heart disease and cancers and strokes and all of the other degenerative diseases. We know that if you eat a plant-based diet, that you will usually not get these diseases. And all the countries of the world who eat the standard American diet, they start dying like Americans. Now, unless we're going to do something significantly, this is going to continue. We need to start at least with one day a week, and maybe people will get to a point where they will do more than one, and their health will improve. Not only will our health improve, we'll save the planet, and we'll reduce the federal budget, the health care crisis. And the cost of health care is going to bankrupt this country.
Camille may be able to answer your question that you posed in terms of how this data can be used and how we're going to address the causes, such as that you just mentioned, nutrition,
Right.
could perhaps be a cause. So if Camille could answer that question, that would be helpful.
Okay.
Yeah, I think that is an important
The
question.
cost, you know, I'm on Social Security. I spend less now than I did when I was eating meat.
I think that she raises a very important point, because nutrition is associated with the top 10, well, with the top causes of death: heart disease, cancers, even stroke, because while most of stroke is associated with hypertension, well, hypertension can be associated with diet also, with, you know, salt intake, with low intake of vegetables and that sort of thing. So I appreciate your saying that.
Well, you know, Dr. Jones, the only way you get cholesterol is from animal and
Yes,
dairy.
ma'am.
You don't get it in fruits and vegetables. And if you stop doing what causes the problem, you won't have the problem.
Yes.
Doctor
I
from the
understand that.
Cleveland Clinic, he has reversing heart disease. We've got to start telling people
Okay.
that they have to change their diet. I'm
Thank
sure
you.
most of you saw Bill Clinton, our former president,
Yes, sir.
who said, I've switched to a plant-based diet for my heart health. Let's
Okay.
start telling people the truth.
Thank you for your suggestion, ma'am. We appreciate that. It's a good suggestion. Are there any other questions?
Juan Lauren with the Nutrition Council, for those of you who don't know me, but we just recently are in the final stages of looking at a food balance study that we did for all of Hamilton County. And so in moving forward, not only is there access to fresh food in these high-risk neighborhoods, through whether it's through grocery stores or, you know, development code for set-aside community garden space, but also what we've found, which was interesting, was access to unhealthy foods. So through fast food outlets, as well as some of these SNAP food stamp outlets that have increased so dramatically, things like convenience stores and gas stations and dollar stores that don't support a healthy diet, but yet get lots of revenue from food stamp dollars. So even moving forward, how can we build into the plan that whole issue of food balance through development and zoning codes, I think, as well as then that other piece of physical activity, the walkable communities and complete streets, and making sure that those communities have central community places that are safe as to be active.
This is your opportunity to give some thoughts on how this can be integrated or considered for the master plan. If you have a thought, go ahead. Don't be. Yeah.
You should hire me to go.
Take the mic.
You should hire me to go into some of it, have small groups where you can impact families and tell them. You know, if you watch television, you know there's 100,000 ads telling people to stay on a high-fat diet. Now, how can the average person compete with that? They can't. You've got to get them in small groups where someone can go in and tell them. The only way you're going to stop clogging your arteries is to not eat the food that clogs your arteries. So if you do that in small groups, they can gradually, and our organization has a plan where we show them how to prepare healthy menus so that they can get their nutrition and understand that they don't have to eat animals to get protein. There's more protein in broccoli than in a steak. They don't know that. Most people don't know it. So you've got to educate people at the grassroots level to let them know that they're killing themselves and they don't know it. And they can't, look, there's trillions of dollars being put into keeping their profits. They don't care if you die early, you know.
So it's possible then we could have the neighborhood planning councils could have a nutrition component in that.
Absolutely.
Okay.
And not tell them you got to throw out everything. Tell them to gradually change their diet. because we have all the scientific information that says you have to stop eating animals. It's very inefficient. Look at the water that we have to use. Even poor countries selling their grain, not feeding it to their people because they get more for it if they sell it to feed food animals. Let's be real. We've got to come to the conclusion. We're going to destroy the planet. Global warming.
Thank you, Mick. Thank you.
Yeah, well, one of the things talking about nutrition is, you know, we need to lead by example. And this morning, if you noticed, what was on the breakfast thing was donuts or pastries. There was a few bagels. I think some were a little bit light brown, which I don't consider whole wheat, you know, but I ate my oatmeal before I came here because I knew that's what it was going to be, you know. So, you know, that's the kind of thing. We need to lead by example. And here we talk about, oh, we shouldn't eat donuts and pastries, and then we're having it for, you know, for this session. So, you know, we all need to, that's that kind of nutrition thing we were talking about.
The Health Promotions Department, and we do work with some of the schools as far as different school-based curriculums with urban gardens and urban farming. We have worked with the Nutrition Council to provide classes to parents as well as students about, you know, healthy eating, and we work with them on different physical activity and nutrition initiatives within the schools. So we are doing a couple things, and I did also want to address, you know, you're talking about going meatless, and I do want to say we have a Healthy Mondays initiative coming up, and I know Mondays are one of the most popular days to go meatless. But we understand that that's a big issue, that's a big change, and not everyone is quite ready to embrace the whole meatless idea. And also, I grew up on the west side of Cincinnati, where this time of year, a lot of people don't eat meat on Fridays for various reasons. And growing up, what that meant was, well, if I'm not going to eat meat, I'm going to eat fried fish, and I'm going to have beer, and I'm going to have pizza, which isn't necessarily where we want people to go. So at that point, yeah, I'd rather have put the chicken salad. But so what we're trying to do is, instead of maybe a meatless Monday, having a more vegetable Monday. Getting people to eat more vegetables, and slowly maybe they might adapt and get to a meatless Monday, but I just don't think necessarily as a city, everybody's ready to go to that level yet. So we hear what you're saying, but we're trying to include everyone.
Well, I just wanted to say that it's enormously profitable. Think about it. It's enormously profitable to treat diseases. There's no money in preventing it. And this DVD, eating, it's the biggest cause of disease and disability and death in the United States today. You can get this online. How do we get it online? Clergyhealthcouncil.org.
Clergyhealthcouncil.org.
But this
Okay.
DVD will change the way you think about food forever.
Okay, thank you.